Well, there's a number of things that I think about when I think about Mary Ann. The first is that she really is entirely focused on our patients. She's entirely focused on our mission. So every decision that she makes, whether it's about how we're going to organize patient care, or how we're going to work or approach an issue with a physician, how we're going to work or approach an opportunity with a physician or other groups of folks, is always rooted in how is it that we can do things better for patients.
Well, nursing is an art and a science, and Mary Ann lives that every day. The art of caring. She is such a caring person for patients, for colleagues, for physicians, and she realizes that it takes a team to provide the exceptional patient care.
She has a great relationship with physicians because she has this trust account. Her professionalism, her sincerity, her transparency, that comes out on a first impression in dealing with her. And certainly we drew from that trust account to establish the hospitalist program. And you can think of a lot of other milestones that we've had in the last 10 years, EPIC, installation, the flood, always drawn upon that trust account from Mary Ann, and you can never really overdraw on it because it's so deep, and that's going to be something I'm going to miss.
But she has the ability, number one, to pick appropriate people, but number two, she looks after the people. I mean, everyone from somebody right under her to the nurse on the floor.
When I first got here and tried to figure out, the leadership positions and who was doing what and who had what capabilities, it's where I first started to hear about Mary Ann as the woman that Dr. Van Orney, frankly, had sort of plucked her from out of the ranks and just simply said, I'm going to promote this individual over a lot of other people because I can see the talent. And so it didn't take long for me to realize that she was the crown jewel. And that she was the kind of individual that we needed in leadership. She brought tremendous knowledge, but she also brought tremendous compassion and credibility.
She took the frontline staff, being the nurses on the floor and at the bedside, and had us be involved in decision making. And through bringing evidence-based practice, something we had never heard of before, or even knew that what it was, things started to make sense. What we were doing made sense, and I just want to say it was so important for the bedside nurse because she knew she was valued, and Mary Ann brought that culture to us.
The thing about Mary Ann, she listens so well. She's a very good listener. She is very practical in her execution of things, which is, I think, what has made her be so successful as she's continued, because she's got that practical sense and she's so well grounded in what actually the work that goes on in a hospital. And then to bring that along with the strategy to move the hospital forward, I think that's where she really excels.
I think Mary Ann is a very sensitive person. She's a very logical person. And I think what I told people, don't ever misconstrue her quiet and her refined nature. She's got a backbone of steel.
I remember the night of the flood. I was at home, and it was about 9 o'clock at night, and Mary Ann called me and asked me to come back to the hospital.
I can remember flying in that night, the night that the river was actually cresting. I was on vacation and came back early when we saw the news, the national news, that the river was rising. The river boats were all crashing into the bridges, and I get back, I go into the command center, and there's Mary Ann and John Sheehan and Michelle, and everybody was calm.
I just remember her gathering all the directors together saying, we're going to the nursing service conference room and we're going to figure this out. She is very deliberate in her processes, and nobody was stressed through that. It was just, we calmly figured out how we were going to take care of the patients in our community through that time. So Magnet was just an awesome experience, really. It started with frontline staff really wanting to pursue that and coming to Mary Ann and saying, are we going to ever do this? We spent countless hours in the war room.
It was a room in the resource center that they had allowed us to use for, to spread out, to collect information, all that kind of stuff. We spent many hours there together into the late night.
There were many times we were here yet at midnight. And if you know Mary Ann, she loves to talk, she loves to joke around. So it was not painstaking to work those endless hours.
But all that kind of goes away when you're sitting in the auditorium and you get the phone call that you've achieved it and you've won it, and the whole room erupts and there's confetti and screaming and laughter, and it just makes it all worth it. And I will always associate Mary Ann being the spearhead for that.
So I've known her for a long time in a lot of different capacities, and through all those years, always someone that encourages you to do your best, challenges you to do things you didn't think you could do, and always with a smile. Always with a smile, Sister Mary Ann.
She's actually been, probably more than anybody else on the staff, been somewhat of a counselor to me. So what I'll miss about Mary Ann is I can have a lot of different conversations with her about situations, about the system, about people. So what I will miss is having the ability to either walk across the hall or to have her walk across the hall, and while we're talking about something that maybe was on the agenda, to also have a few minutes to just talk about the life we're leading and how we're trying to figure our way through it and the challenges of it. And so I will miss that personal side even as much or more as I did the professional side, because she's been somebody that I always thought I could talk to about the biggest problems we had here as an organization, oftentimes the people challenges that we had in the organization. She knew them all, and she's seen them all, and she would be able to just sort of help me think through, or she'd just listen to what I needed to be telling somebody. So that's what I'll miss the most.
I can't even imagine how I'm going to feel on February 15th or whichever day it is that she doesn't walk in that office, or more likely I walk in the office after her. She really has been, for me, kind of the other half of my head and the other half of my heart, for these many years. And, we're making plans to figure out how we can go on and do her proud as an organization, but you can't even quite put your finger on what you're going to miss, because there's just so much that she brings every single day.
I keep saying I need one of those bracelets around my wrist. What would Ann Osborn do? I might have to look at it a lot. But she's also prepared the organization for this day, and she is in a role that's really going to help not only us, but healthcare within the state, within the system, and there's no better person to do that. And so I wish her the very best, and I thank her for everything she's given to not only my career, to me personally with her friendship, but to the organization as well.
I just would like to congratulate her on the next chapter of her life, of her professional life. I think UnityPoint Health is in a great position and is very, very fortunate to have Mary Ann leading the care model. She is very, very patient-focused, and that is near and dear to her heart, and I believe that we will implement the care model very, very well under her direction.
It's very sad to see her go from this environment, but the job that she has is perfect for her and it's perfect for the system. And so I think there's still going to be a lot of interaction, and her presence will be there just because that's such an important initiative for the system. This is our work going forward, and she'll be there, and she'll be the head of that. So I think we'll still feel her a lot.
It's been probably a pleasure and a joy to be working with her for the 35 years, basically.
Mary Ann, thank you for everything that you've done for all of us here at UnityPoint Cedar Rapids, at St. Luke's, for Ted Townsend personally. You will be missed on a day-to-day basis, and I'm just grateful that you're not leaving this system. I'm just grateful that you're not retiring. I'm just grateful that you're still going to be here working with us, even in a different capacity.